Hi everyone, my name's Charlie Player. I'm a A&E registrar in Barnsley Hospital in South Yorkshire and also one of the clinical fellows there. Just would like to present a small study that we carried out in our hospital, essentially exploring patients' views on primary care referrals to our emergency department. That was carried out in the COVID pandemic. So it's probably not a huge surprise, but there's been significant overcrowding within emergency departments and hospitals throughout the UK, especially over the last few years. For example, 25 million attendances years 2019 to 2020, which is 17% increase on the previous decade. And just to give you an idea, there's just under 1 million referrals from primary care each year, which roughly equates to about 21% of attendances. And as we know, there's been a significant pressure on GPs to deliver the care that they want to their communities and their patients. There's very limited literature investigating the reasons behind why GPs may decide to refer a patient into the emergency department. Many focus groups have found that patients often prefer seeing their GP within the community rather than going to A&E. Unfortunately, with all primary care, there's time pressures, limited appointments, and there's often only a 10-minute time slot. And unfortunately, if patients can't get an appointment at GP surgery, they often find their way needing to be seen in the emergency department. One study from Germany showed that a decrease in availability of practice services leads to an increase in referrals. This includes both a limited number of appointments along with the restricted time of just 10 minutes. High levels of deprivation often have higher GP referrals to ED. This is relevant as Barnsley is the 20th most deprived town in the UK. Another potential factor is the level of experience and training of the doctors working in primary care. A study found that GP registrars and junior doctors often have a higher percentage of referrals than fully qualified GPs. Potentially this could mean that they just haven't potentially received the support and guidance needed to know when an actual referral is necessary or appropriate. There may be some doctors that may be risk averse and they feel that the safest thing to do is to send the patient into A&E to rule out any potential serious pathology. GPs will obviously refer patients that they think do have worrying symptoms or presentations and need sort of urgent investigations, or they're unable to rule out potential pathology in the community, like a DVT or a PE, for instance. And then there's the cases where the GP is unable to refer directly to a specialty. And unfortunately, the gateway to the hospital is via A&E. So we had a few aims in this small study. Wanted to sort of look at the type of contact that patients receive from their general practitioner, the methods of referral, why they were referred into the emergency department, and then actually getting the perspectives of the patients themselves on the current care that they received, where they would want to be seen, and sort of trying to identify any common factors and if there's any sort of underlying reasons why referrals may be deemed as unnecessary. So this study was small in nature, only lasted a couple of weeks, looking at the patients referred by GPs in the Barnsley area. We initially did an initial pilot study which sort of created a questionnaire that was appropriate to the population we were interviewing. So essentially just a quick journey. You'd get a patient that presents to A&E, they'd book in a reception, they would identified as being referred from the GP. Essentially eligible patients were checked on the emergency department board. They're then located and identified. There are just some general screening questions to make sure that they were actually referred from the GP. Given a confidential ID number, which is essentially assigned with their hospital number, and then a survey was completed with the patient. we actually decided to do these face-to-face, as some patients potentially had some visual difficulties and some struggling with reading, with the Barnsley area actually being the 10th most deprived local authority for education, skills and training. So some of the results. So just a quick look at the demographics. Nearly a half split with regards to male and female. We had a reasonably representative sample across the ages, from sort of the under 5s all the way up to the over 80-year-olds. As you can see, Barnsley isn't a particularly ethnically diverse place, with the majority being essentially white working class background, being an old mining town. So just looking at some of the results, due to the COVID pandemic, there's been a change with regards to how appointments are carried out within primary care. So you can see that only a quarter of patients actually had face-to-face appointments. Over half had some sort of telephone or video consultation. Multiple patients were just a discussion over the phone with the receptionist, or the receptionist in person told them to come into A&E. So we're actually looking at who actually referred them. So, what you'd probably expect, 70% were actually referred by the GP themselves, but potentially concerning, 23% were advised by a receptionist. I do appreciate that some receptionists are trained to triage to a certain degree, or there are certain presentations that they're advised to refer to A&E, but it was a higher proportion than I was expecting. So with regards to reasons for their referral, some of the main common themes were either there are no appointments available, the GP advised that if their symptoms get worse that they should turn up to A&E, they think that they need some tests in hospital that can't be done in the community, or that they're just generally concerned about the patient and they thought that they needed to go into hospital. Quite a mixture of presenting complaints, ranging from breathing problems to cardiac problems, generally unwell, potential injuries, so a varied mix there. Looking at where patients would prefer to be seen, or sort of the contact that they receive, a lot of people did want to see their GP in person. A lot of people didn't have a preference, and ultimately they just said that they wanted to get seen by a doctor, if that be at their GPs or in hospital. They just wanted to get seen and sorted. Multiple limitations of the study, which I'll just mention briefly. So obviously it was only done in one hospital, only over 2 weeks. It was only unfortunately done within sort of research hours, which for our team that was carrying out the questionnaires was only 8 till 5, unfortunately. Small sample size of 200 people. There were also some potential selection problems with regards to there may be some people that slipped through the net that may have not said that they were referred from their GP, and this may have been missed out. And then the actual environment itself, it's a stressful environment, and patients may not have given the same answers as if it was done elsewhere. The COVID pandemic really has changed the way that patients are seen within primary care, with a massive uptake of telephone and video consultations. This is seen in our study, with only 25% of patients being seen face to face. There are many occasions where it's completely appropriate to just have a telephone or video consultation with your GP, but there are many times where face-to-face appointment really can be beneficial for your patient. And unfortunately, there's multiple patients that get sent to A&E where unfortunately their GP is unable to provide a face-to-face consultation. There still ultimately is that desire from a patient to be seen face-to-face. Obviously, in our study, there was a lot that weren't hugely bothered whether that was a GP or in A&E. Ultimately, they just want to see a doctor in person rather than over the phone or video. We found that the decrease in this face-to-face consultation has also led to a decrease in the amount of patients being referred in and presenting to A&E with letters or some sort of detail of assessment by their GP. We found that over 75% of patients didn't have any referral letter whatsoever, which can be very useful for when we're assessing the patient in A&E. There were many referrals that were made by receptionists, and it's hard to know whether these receptionists had any training in triaging or such like. Ultimately, there are not enough GPs to provide the full amount of appointments, and demand that unfortunately is only ever rising in the community. Some things that have improved since this study is the introduction of the same-day emergency clinics from medicine and surgery. So these are set up to see ambulatory patients in the hospital that can be referred and essentially bypass A&E if they have a specific question or a specific concern about a patient. This study has allowed a greater insight into patients' views on primary care referrals, and whether it would change the referral outcome. You'd need to do some further research on this. It would be fantastic if we could do some research at multiple sites across the UK to gain more data and allow further comparisons to be made. Management of GP referrals to ED is an issue that needs to be investigated further to help manage the increasing demands on A&E services and hospitals, which unfortunately are increasing every year. But many thanks for listening. If you have any questions or comments on this presentation, then please feel free to contact me directly at the email address there. Thank you very much.